My dear students, today I will be taking up a very important topic from radiology, and my today's focus would be some important lesions seen on chest radiography as far as calcification, as far as honeycombing, and as far as cavitation in the lungs is concerned. We get a lot many questions based on the chest radiographic findings of different ailments. Now, as far as the first topic I would be covering today is the calcific foci seen in chest radiographs. There are multiple conditions which cause calcific foci in chest radiographs. So what are them? Taking them systematically. First of all, going to the infective causes which cause calcifications within the lung on chest radiograph. We are well aware of Mycobacterium tuberculosis causing tuberculosis, and tuberculosis is more common in the underdeveloped world, and with the emergence of HIV and other immune compromised states, tuberculosis is again on the rise. So tuberculosis is a caseating granulomatous condition causing calcification within the chest radiographs. Now, we are also aware of these two diseases, especially histoplasmosis and coccidioidomycosis, more common in the United States, and they are a very important cause of calcific foci within the lungs. An important viral disease, chickenpox, which was more common in the past, happens to be another disease causing calcification within the lungs. Actinomycosis, hydrated cysts of the lungs, I mean to say alveolar hydratids, are very important causes of calcific foci as far as infective etiology is concerned. Tuberculosis, histoplasmosis, coccidioidomycosis, chickenpox, actinomycosis, and hydrated cyst happen to be very important causes of calcific foci within the lungs. Chronic abscesses due to any organism can cause calcification within the lungs. Now, as far as the malignant tumors are concerned, they are also a source of calcific foci within the lungs, and metastasis, especially from osteosarcoma and chondrosarcoma, happen to be most important causes of calcific foci as far as metastatic lesions are concerned. As far as the benign lesions of the lungs are concerned, AVM, atrioventricular malformation, and atriovenous malformation, hematomas, and carcinoid tumors, they cause calcific foci within the lungs. Now, we also get questions like, what is popcorn calcification, and what lesions produce popcorn calcification? Typically, popcorn calcification is associated with pulmonary hematoma, and that you have to remember. Then we are also asked this question, what are the causes of eggshell calcification, eggshell nodal calcification? And you have to remember those occupational lung diseases, especially silicosis, which causes a classic eggshell nodal calcification. In addition, you have to remember sarcoidosis and bilateral hilar lymphadenopathy, potato nodes associated with sarcoidosis, and sarcoidosis is another important condition which can cause eggshell nodal calcification, in addition to histoplasmosis and blastomycosis. So a single disease can produce multiple types of lesions. Say I just said histoplasmosis causing calcific foci, but it also causes eggshell nodal calcification. So you have to remember these things. Now, bullseye calcification is usually seen in the form of central dense nidus with laminated centrifugal calcifications, and it is classically seen in case of granulomas. Now, in addition, you have to remember that a question frequently asked is honeycombing of the lungs. What are the important diseases which cause honeycombing of the lungs? Interstitial lung diseases are a very important cause of honeycombing of the lungs. In addition to sarcoidosis, extrinsic allergic alveolitis is a very important cause causing honeycombing of the lungs. In addition, there are certain drugs, and these three important drugs you have to remember very essentially. They are sometimes asked as causes of honeycombing of the lungs. Number 1, bleomycin, number 2, busulfan, and number 3, nitrofurantoin. I just repeat, bleomycin, busulfan and nitrofurantoin, a question so many times asked. In addition, connective tissue disorders like SLE, like Sjogren's syndrome, like rheumatoid arthritis, like scleroderma are a very important cause of honeycombing of the lungs. In addition, we have got this disease, especially in children, cystic fibrosis. And cystic fibrosis is a very important cause of honeycombing of the lungs. In addition, oxygen toxicity can also cause honeycombing of the lungs. So these are some of the very important diseases causing this radiological feature of honeycombing of the lungs. Now, there are certain important diseases, clinical conditions which cause cavitation within the lungs, and a question quite frequently asked. So what are the important diseases which cause cavitation within the lungs? Number one, they can be congenital in the form of congenital bronchogenic cysts or sequestration of the lung. Even traumatic lung cysts can cause cavitation of the lungs or cavitating lesions within the lungs. In addition, histoplasmosis again figures here. It is also a cause of cavitation of the lungs in addition to hydrated disease. Now, in addition to hydrated disease, we have got sarcoidosis as well as pulmonary infarct and lymphomas and metastasis, which also cause cavitation of the lungs. So you have to remember these important points about the conditions causing cavitation of the lungs. Thanks a lot.